Welcome to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. We have a very special topic to cover with you all today. What's happening in rural communities? Too often, the contributions, the needs of people living in rural communities in America are overlooked and aren't discussed, but we are going to resolve that today. Coming on with us, we have Chuck Strand, who's Executive Director of Rural Minds. Welcome, Chuck.
Hi, Kristen. Nice to be here. Thanks for the
Hi.
opportunity.
So glad you're here. So glad you're here. Can you share a little bit about the background of Rural Minds overall?
Yes, well, Real Minds is the only national 501c3 nonprofit that's focused on advocating for rural mental health equity, promoting mental wellness, and providing educational content to confront rural mental health challenges and the stigma that surrounds mental illness. So there's 46 million people living in rural America, and those folks are living in farming, ranching, agricultural communities, small town, isolated areas across rural America. So that's really our goal. We want to really address the underserved needs specific to mental health for rural America.
I'm so glad you're here because this month is Maternal Mental Health Month, and your organization, again called Rural Minds, exists in large part to serve the quote informed voice for mental health in rural America. What
Exactly.
are the special challenges that new moms, particularly in rural areas, face? And how are your communities being served regarding to perinatal mental health? What's happening?
Well, I think the challenges surrounding perinatal mental health really fall under the broader scope of rural mental health challenges. And there truly is a mental health emergency in rural America. Compared to urban areas, people who live in rural America have higher rates of depression and suicide, but they're less likely to access mental health care services. And according to the CDC, the Centers for Disease Control and Prevention, suicide rates among people living in rural areas are 64 to 68% higher compared to people living in large urban areas. And I can go on too if you're interested in hearing more about the challenges, but I'll take a breath and see if you want to respond to any of that information.
I would love to hear more about the challenges. When I had my first baby, I was living in a rural area and I was like, it takes 30 minutes to drive to the grocery store. There is no local group for me to hang out with of other new moms. It was the most isolating experience I've ever experienced in my whole life. And then we soon moved in closer to a center where I could actually walk to the grocery store. But it was hard. So I'd love to hear more about different aspects of how rural areas are both beautiful and glorious and offer special opportunities for, often being in nature and having like lots of things that you can't have in the city, but also what are the special challenges?
Yeah, well, that's true. There's pluses and minuses for sure. And I'm sorry to hear about your challenges. And unfortunately, that's not uncommon. And in addition to the greater distance away from services and healthcare, there's greater stigma or shame that surrounds mental illness in rural communities. And a barrier to healthcare in rural areas, it really also includes financial constraints. Mental health services can be expensive, and rural residents may have limited access to affordable insurance or financial assistance. And specific to the access to healthcare, especially mental health care, that's a real challenge because only 35% of rural counties have a psychiatrist and just 19% have a psychiatric nurse practitioner. And then beyond that, even for primary care physicians, the folks are looking at 20% fewer PCPs in rural communities rather than when you compare it to urban areas. And to your point earlier, it's you're further away from getting a fewer number of PCPs get challenges in getting an appointment. But then when you're actually going to your appointment, you've got to travel further. And some people don't have access to cars. You've got to arrange transportation. And just one more point that's specific to women living in a rural area. Less than 50% of them have access to a perinatal service within 30 miles of their homes. And with about 1 in 8 women experiencing postpartum depression, this distance could be detrimental in addition to all the other challenges that women who are expecting or having just had a baby are confronting.
I mean, and this challenge that we're talking about are there before we had Trump and the Republican-led budget moving through Congress, which is proposing or has been proposing $880 billion with a B and cuts to Medicaid. And Medicaid is actually what keeps the doors of many rural hospitals open, is what funds many rural health programs, including rural mental health care programs. And it is just appalling to me knowing people who live in rural areas, having family in rural areas, to even have Republican leadership in Congress and Donald Trump proposing or contemplating pulling out the resources that are there now, because the resources now are not enough. We need to expand access to healthcare in rural areas, not roll it back. So that's just my little editorial moment, my hair on fire moment about expanding rural health access, not rolling it back. And I'm just appalled again that the Republicans and Donald Trump are trying to roll it back. And when they roll back programs like Medicaid, it actually increasingly adversely affects rural areas, because many states, which are majority rural area states, have, the majority of their state budget, more than 30% of their state budget, actually funded by programs like Medicaid. So again, if you live in a rural area and you're looking at what's happening with the national budget, call your member of Congress and say, hey, no cuts to Medicaid, hands off Medicaid, hands off also SNAP, hands off childcare, because those programs actually increasingly help the families and the economy of rural areas than almost any other area. I want to dive back into a question about maternal mental health in rural areas related to the substance use epidemic. Do we see different situations in rural areas happening related to maternal mental health and substance use?
Well, just from a wider perspective, a study that I believe was done by the Indiana University indicates that stigma around substance use disorder is greater among people living in rural counties compared to urban counties. But when we talk about substance use disorder, it's important to acknowledge that alcohol is a drug, and I've got a couple stats to consider if you'd like me to share those.
I love stats.
Okay. Studies suggest that rural areas are often experiencing higher rates of alcohol-related deaths and harm compared to urban areas. The opioid overdose rate is 45% higher per capita in rural communities than in urban areas. And only 14% of US behavioral health outpatient treatment facilities are located in rural communities, with less than half of them specializing in treatment of substance use disorder.
Those are really painful stats.
Yes.
Thank you
Yeah.
for sharing them.
Yeah.
What?
Go
Go
ahead.
ahead.
I would say, in addition, that most patients diagnosed with substance use disorder experience guilt, shame, or embarrassment, and this can be compounded for women who are pregnant or new mothers. These feelings that can either have a positive or a negative impact on whether or not a woman initiates treatment for substance use disorder. But because the circumstances, they can be motivational for some women, but others may be reluctant to initiate treatment just due to the stigma and maybe a concern that diagnosing a substance use disorder may result in losing custody of her baby or other children. And there's other, potential barriers to like treatment. The barriers to the treatment include like the housing and the food insecurity, transportation or lack thereof, and just demands of childcare.
This is a really heavy data, and I'm so
Yeah.
thankful for you for sharing it. And given that we have this threat of Medicaid cuts, which actually fund a lot of the programs and even the doors of rural hospitals staying opened, how would that threat impact rural mental health resources, particularly for moms in rural communities? Like, what is on the line right now?
Yeah, well, just to take a step back, the mission, as you kind of mentioned, part of it as far as Rural Minds, we want to serve as the informed voice for mental health in rural America. And we do take an apolitical stance on what's happening, but it's part of we feel it's part of our duty, specific to being the voice of mental health, informed voice, because a lot of things are happening that have an impact on how stressed out people are, how much anxiety people feel. So we feel like it's important for us to share the facts, and people can do with that information what they choose to do. But we also do provide access to people reaching out to their member of Congress. But to your point earlier, the reduction of federal funding for Medicaid it'd have a disproportionately negative impact on providing health care in rural communities, since a greater percentage of people living in rural America rely on Medicaid benefits. And in rural areas, incomes are lower. Fewer people have employer-sponsored insurance compared to other parts of the countries. So any cutting of Medicare would definitely be detrimental. And I've got some more numbers if you're interested in more details.
I always love numbers. The numbers are
All
awesome.
right.
I have to tell you a little secret.
Yeah.
When I was out in the rural area that I was living in when I had my son, and had this infant, he actually had a significant health crisis. He was born with a primary immune deficiency, and so he was really sick. And so I was out in a rural area with a infant who was sick, and I was feeling very alone. So do you know what saved me? Numbers. I did what anybody does when they are having an emergency in a rural area. I called the U.S. Census.
Okay.
I called the U.S. Census and I said, how many parents are there out there who have been pushed out of the labor force? In this instance, because I didn't have any paid family medical leave when my baby arrived, and my baby arrived with a serious health crisis, I, lost my job, right?
Mm.
And so I was like, how many people are there out there who are uh, out of work, out of the paid labor force, and raising kids? And the U.S. Census told me, I do not know. We do not know. We only know how many people there are in the shadow of a married spouse. And we know why that data is not necessarily helpful, because, a significant amount of people are unmarried. And so what they did tell me is that families with a stay-at-home parent, were 7 times more likely to live in poverty than those with 2 full-time working parents, which makes sense.
Yep.
Need moms in the labor force to make ends meet. So that moment of numbers made me, as a new parent, feel so much less alone, though, because I learned that there are millions and millions and millions of people like me out there. And so I love your numbers. What were the numbers you were about to share?
Well, back to the Medicaid, any cuttings will negatively impact healthcare overall, but the services treating mental health and substance use disorder are really a standout. And approximately 18 million women of reproductive age live in rural areas, where they are more likely to experience maternal health risks than the women living in other areas. And Medicaid plays an important role in providing maternal health care, and pays for a greater share of births in rural areas. So cuts to Medicaid would shift additional costs to rural patients who already may be struggling with financial instability. Without Medicaid, higher out-of-pocket expenses will force many people to delay or just forget about necessary treatments. So this would ultimately worsen health outcomes for folks in rural communities.
So, listeners and viewers, one of the things that numbers do is show that we're not alone. Show that if you are feeling isolated, you are not the only one out there experiencing that situation. And in this area, when we're talking about access to mental health support, access to healthcare, it's so important for everybody to know that you're not alone and that you can get help. We only have 2 minutes left, but Chuck, can you share with us how people can get help and get to your website and take action? And, what are our next steps?
Yeah. Well, all the barriers to rural mental health that we're discussing have been part of what's led to establishing Rural Minds and the work that we're doing here. And we're all about providing information that's free to confront mental health challenges in rural America, along with the greater stigma that surrounds mental illness. So the Rural Minds website, which can be found at ruralminds.org, that's RURALMINDS. We've got a compilation of free information about postpartum depression, in addition to other mental health challenges. And at the top of the list for crisis resources and support is 988, the Suicide and Crisis Lifeline. So as you may know, 988 provides free confidential connection with trained mental health counselors. We also have a mental health conditions fact sheet on postpartum depression on our website, and a web page with mental health resources by topic, which includes several listings specific to postpartum depression.
Thank you so much for sharing that. Thank you so much for being on. Thank you for all you do. Thank you, thank you, thank you.
Well, thank you for the opportunity. It's been great. Appreciate it.
Thank you.